راح أحكي اليوم عن laryngology manifestation of it. It has been well documented that 70 to 90% of patients with HIV will at some stage present with an ENT manifestation of the disease. المعروف إنه AIDS itself representing only the very last stages of this infection. من المعلوم انه مدى ظهور السيمبتومز and manifestations مرتبط ب CD4 count. When the CD4 count over 500 cells, most patients are asymptomatic manifestation. When the CD4 count 200 to 500 cells, the early manifestations of HIV start to appear. Below 200 cells, patients become in danger to many of processes associated with AIDS. Below 50 cells, patients become at risk for unusual opportunistic infections. أكثر cases of otolaryngologic manifestation of HIV disease بشكل عام إما infections or neoplasm or primary neurologic damage caused by HIV. الظهور المانيفستيشنز بيكون اما بالاورال كافيتي or sinonasal manifestation or neck manifestations or otologic manifestations. اول manifestation عندنا oral candidiasis هو earliest and most common finding. There is 4 different types: pseudomembranous candidiasis, hyperplastic candidiasis, atrophic candidiasis, and angular cheilitis. كمان في عندنا esophageal or pharyngeal candidiasis should be suspected if, in patients with oral candidiasis who complain of a severe sore throat or difficulty in swallowing. التريتمنت للcandidiasis in the early stages of HIV يمكن أن we can use nystatin or clotrimazole as topical agents. بينما systemic therapy with ketonazole often improves thrush that is unresponsive to topical agents. In cases with increasing immune deficiency, we can use systemic therapy with fluconazole and amphotericin B. The second manifestation في عندنا leukoplakia often indicates progression to AIDS. The lesion most frequently appears on the lateral aspect of the tongue. It presents as a hairy whitish plaque, looks like a hyperplastic type of oral candidiasis. The Epstein-Barr virus is the most likely causative agent. Treatment for leukoplakia, the lesions treated with acyclovir, sulfa drugs, zidovudine, or topical retinoic acid. في عندنا third manifestation oral herpes simplex, frequently associated with HIV disease. يمكن أن تظهر the herpes labial is the most common presentation. Also, crabs of fever blisters occur on the palate, gingiva, or other oral mucosal surfaces. These lesions tend to be larger and more numerous, recur more frequently, and often persist longer إذا ما قرنت بال non-HIV infected patients. في عندنا المانيفستيشن الرابع oral Kaposi sarcoma. By far the most common oral malignancy in HIV disease can occur anywhere in the oral cavity. Nearly 95% are found on the palate. At first, these lesions are flat and symptomatic, then become exophytic and ulcerated. Secondary infection often occurs, producing severe increasing pain, difficulty with mastication and swallowing. Treatment of Kaposi sarcoma. Kaposi sarcoma is very radiosensitive and localized tumor. Tumors respond well to low dose radiotherapy with a good palliative result. HIV positive patients more oversensitive to radiation-induced mucositis and cannot tolerate wide-field radiation. المانيفستيشن السادس في عندنا أو الخامس في عندنا oral non-Hodgkin lymphoma. Non-Hodgkin lymphoma occurring with increased frequently in patients with HIV disease. Frequent involved sites include the gingiva and the palate with extension into or from Valder ring, especially the tonsils. Non-Hodgkin lymphoma generally is a grim prognostic sign. يتم تشخيصه عن طريق غالبا عن طريق البيوبسي. هلا من المانيفستيشنز in sinonasal area between 40 to 70% of patients with AIDS will present with allergic rhinitis, sinusitis. The most common sinonasal complaint is that of a blocked nose. The most likely causes being adenoidal hypertrophy and allergic rhinitis. Adenoid hypertrophy presents as persistent nasal obstruction in the adult patient. This requires further investigation and the possibility of HIV infection must be in consideration. In HIV positive patients, enlarged adenoid most commonly due to lymphoid hyperplasia and generalized lymphadenopathy. بالإضافة إلى في أن enlarged tonsils are frequent part of the clinical picture. Lymphadenopathy is thought to be related to B-cell activation by HIV, Epstein-Barr virus, and cytomegalovirus. الادينويد hypertrophy تسبب otitis media with effusion وما يتلوه من conductive hearing loss نتيجة obstruction of the eustachian tube. العلاج بيكون adenoidectomy ممكن يكون frequently to relieve symptoms and nasal obstruction and that's medial effusion. Lymphoma is treated with systemic chemotherapy and radiotherapy. Allergic rhinitis, very common in the HIV positive population because the patients have increased levels of IgE. These high levels of IgE then lead to increased IgE-mediated allergic symptoms. Treatment consists of allergen avoidance, topical steroids, and oral antihistamines. Rhinosinusitis occurs in 20 to 70% of HIV-infected patients. Predisposing factors include allergic rhinitis with edema mucosa leading to obstruction of the sinus ostia and decreased local and systemic immunity. The microbiology is similar to that found in the HIV negative population with the exception of two atypical organisms, Pseudomonas aeruginosa and Aspergillus fumigatus. Neck manifestation. Up to 90% of patients with an ENT manifestation will present with the neck mass as well. The differential diagnosis of neck mass in the HIV positive patient can be broadly divided into HIV lymphadenopathy, parotid disease, infections, and neoplasm. Parotid gland enlargement commonly presented in HIV-infected adults and children who are not on antiviral therapy. Etiology thought to be related to a lymphoid response to HIV infection. Patients usually present with bilateral painless parotid hypertrophy. Treatment is guided by the severity of the cosmetic deformity and includes antiviral therapy, multi-aspiration of the cystis with tetracycline sclerosis and low-dose radiotherapy. Otological manifestation the incidence of higher and they are higher in the most common otological problems reported in HIV infected patients are serous media and recurrent acute otitis media, and they are higher in the HIV population than in the general population. We have also sensorineural hearing loss, both unilateral and bilateral, occurs in 20 to 50% of HIV infected patients. Finally, vertigo can occur in the HIV infected patients Piotagio is frequently a symptom of subacute encephalitis. HIV may directly affect the vestibular and auditory systems. And shukran. Thank you.
Thank you very much, Dr. Firas. Allah يعطيك العافية for this interesting lecture. I will just give one comment about this lecture. And generally, all these symptoms and all these manifestations, they also come in normal people, in healthy people. So the main issue is how to differentiate or how to have a low threshold to diagnose a patient with HIV and think that there is something behind the just having candida in the throat or thrush in the larynx or in the throat or having recurrent sinusitis. So the most important thing, especially to our residents, is to just think of these uncommon things that happen maybe once a year to pick a patient with HIV. So if you have a patient with recurrent sinusitis or a patient with severe invasive sinusitis, fungal sinusitis, a patient with candida that is really difficult to treat, you give him couple of days treatment and there's no much improvement, and he's coming with recurrent ulcers, recurrent leukoplakia in different places, then you have to at least refer him to somebody who is specialized in HIV or infectious disease. So have just a low threshold of diagnosing such rare diseases. This will improve the life of the patient, and maybe you will pick the patient in less severe symptoms. So all these problems can happen in normal people, but it's when to think that the problem might be HIV related, then you might help them much. Anybody has any question or comment?
دكتور ابراهيم صباح الخير.
صباح الورد. اهلا دكتور حسام.
خلينا بس نذكر نفسنا السيرجري in HIV patients. Do you remember what is the safe count for CD4 to operate on HIV patients? أنا أعتقد كان في كده يعني some criteria إنك you can safely operate risk of infectious حيكون low إذا الفيرال load عند عدد معين. ما أعرف إذا حد فاكرها صراحة، أنا ماني متذكرها، بس فرصة نسأل.
Well, I'd say it's a good thing to search for it. I don't know. Anybody knows the answer? Definitely not below 200, but I don't know the exact answer.
ممكن فراس يشوف لنا الموضوع يرجع لنا فيدباك. أنا أعتقد إيوه الفيرال لود لازم يكون at level very low so you can operate safely on the patient with very low risk of infectious transmission. طبعا السي دي count المفروض يكون almost back to normal or close to normal to be يعني safe to operate for the patient himself عشان to avoid any infection. بس الفيرال لود أنا I can't remember the number.
You're speaking about elective surgeries rather than surgeries related to the HIV itself, like invasive fungal. Yeah, but if the patient has, for example, invasive fungal sinusitis, we are ought to operate even if the CD4 is very low, because it's an invasive process.